Hi, I'm Dr. Mark Jagger, creator of this device you see before you here called the Spine Specialist, and you asked for a little bit more information. So what I'm going to do is give that to you. So one of the main questions I get is, how is this different than a spinal decompression table with a laser attached to it? Well, at its core, that's exactly what it is. My story is I've been practicing with laser and decompression since probably about 2007. I used a handheld 3B laser and a Triton DTS table. Phenomenal equipment, worked very, very well with patients. But as we started getting into things and getting the more and more difficult patients, I felt a need to upgrade the technology, find different ways to combine things, different ways to utilize technologies together to try to get patients over those plateaus, and also to try to get patients that were really, really in a bad way better, even though other things that they had experience with didn't help. So that's why I redesigned and put a bunch of different capabilities into this device so I could treat patients in a slightly different, more advanced and more capable way. Like I say, at its heart, a robotic laser attached to a spinal decompression table is exactly what this is. We can treat low backs, we can treat necks, we can treat hips, we can treat knees. So you have a whole bunch of additional things that other decompression tables don't really focus on that you're able to work with. Protocols in our training delineate how to do that. There are different protocols in the laser that actually will help you do that type of thing. And so all of this is integrated into the system, mainly because I needed a system that did all this stuff for me. So on the business side and on the patient helping side, if you've got a table that does one or two things, you can help a patient with one or two things. If you've got a patient that does six areas of the body, you've got 6 areas that you can choose from that patients may have problems with. You have that many more patients that you may attract to what it is you do, because hey, I can do knees now, I can do hips now. Those patients that come in may have 3 or 4 of those problems, and once you're done working and fixing one thing, you move to the next. So from the capability standpoint, you can help a lot more people. From the business standpoint, you can attract a lot more people. So let's go a little bit through the table here. At the head of the table, this one is actually one of my demos, so we don't have the cervical piece set up. There are a couple different videos of the cervical piece that I can show you just to give you the rundown of it. But with our cervical piece, what I did was I put a lateral flexion capability into it, flexion and extension. Mainly because the cervical disc patients that I had, the best way to get at a cervical disc is to laterally flex and extend to get that disc distracted. Also, it helps with stretching the scalenes, stretching the upper traps, levator, posterior cervicals. Being able to do all those different angles can really help you focus on where the patient is having the problem, and also gives you a little bit of treatment variability, so that way you can stimulate the area that you need to get at. You can create different stimulation by different angles of stretch. That always keeps a patient improving. So having that versatility in lateral flexion, flexion and extension gives you a whole bunch of different options that you can use with that patient to try to get them better. Makes the machine more capable, which means that you can treat more things that people are having more difficult problems with. So moving down the table, in the center is the robotic laser. So it resides right underneath. There are a bunch of different programs in the software that actually will allow you to focus on different areas. So where I had a problem with most other decompression technologies, when they said, well, I can specifically isolate a certain area. Well, from my perspective, if I tie you here and I tie you here, and I pull in that direction or that direction or that direction, it doesn't really specifically isolate that disc. To a certain point, you can angle things to focus on upper or lower lumbar, but you can't really isolate that disc. So I thought, well, if I want an x-ray of a certain specific spot in the spine, what do? I point the x-ray tube at that spot. Therefore, I get a picture of that area. We use the same type of targeting system with respect to the robotic laser. So if I know that I want to treat L4, L5 disc or L5S1 disc area, or I know I want to treat an L2 disc, I can position the patient over the machine, over the robot, and I know by virtue of the program that I've set in this machine where that laser is going to end up. So if I want to treat L4 to S1, I can have a program that sends the laser directly to that area. So essentially the laser will do the whole back, then it'll come back and do a second pattern in the area where the disc injury is, where the area of the pathology of my patient resides. So the other thing with respect to stretching and specificity of stretching, if I have a segment of the spine this long and I do the whole area to soften and relax the muscle and I start pulling on it, it gets that whole area. Then I take the laser and I move back to an area here in the lower lumbar and I further relax and soften the muscles. Then that stretch that I'm applying up here will apply a little bit more in that area that I'm softening and relaxing further. So it's like if you were to take a piece of taffy, interesting analogy, and stretch that out, but then you were to heat it in this area and it were to be softer in that area and it were to stretch more here, even though you're pulling here. That's the type of thing we're trying to influence by having the laser in specific spots and running in specific patterns to try to influence that. Now, that being said as well, if you have a right-sided disc injury, we have protocols to focus on the right-sided disc injury. If you have a left-sided disc injury, same thing, protocols that integrate with our traction recommendations or decompression recommendations that will integrate with the laser. So that's how this system has a little bit more versatility and capability than the average decompression machine, because there's all these things that we can change. Angle of pull to focus on a specific area. We can do hips as well, and we can do knees. How we get into that, there's a protocol that will do the lower back and can focus on the SI joint on one side or the other. And then we put the leg in an arrangement that actually focuses the pull on the leg and the hip joint. So we can pull like this to increase the joint space in the ball and socket of the hip joint, place the hip joint over the laser, so the laser's softening and relaxing that hip joint as we're stretching it out. When we get down to knees, we have a separate laser. In fact, if you're in your clinic, you can use a separate 3B laser. That's what we do a lot of time in ours. Or you can use a separate class 4 laser to do knees. Now, so that gives you a little idea of the versatility, the different little features that we've run through this. What I'll do is a separate little video that shows you the integration of the software. We'll attach it to this. It's another big thing, being able to do simultaneous lumbar laser and decompression at the same time. That actually brings your treatment time down, so you can treat twice the amount of patients instead of having to do their laser first by hand for 10 minutes and then put them on the table afterwards. So not only is a robot doing a lot of your work for you here, but you're also improving the time with which it takes to treat the patient, and you're also doing it in the same room. So you don't have to have a separate area for laser, you don't have to have separate staff for the laser. The robot is your staff, and you can do it all in one room. It's also the size that most therapy tables are, so that's another thing that we're very cognizant of, making sure that it would fit in most therapy rooms. Some of the decompression devices are so big that they just don't fit comfortably into a room. That makes it so that, in order to get into some of these decompression machines, you need to have a separate place. We wanted to make sure that it was nice and accessible. And as you can see, our rooms here are regular chiropractic rooms. I wanted to be able to do everything that we could do in a regular chiropractic room on this table here. So that's the other video looking at the software itself. But yeah, if you have any questions, please feel free to get in contact with me. My cell is 647-290-1296, and I don't mind you calling me directly, texting, WhatsApp. You can even do email if you like. Email is at info@spineadvanced.com, so SPINEADVANCED. So info@spineadvanced.com. You can look up our clinics and some more information on the table at spinespecialistclinics.com. Spineadvanced.com also points to that too. So I look forward to speaking with you. Thank you very much for your request for additional information, and I hope this has given you sort of a rundown of how this device has been designed to be different and more capable than anything else on the market. Look forward to talking to you.